So, as one of my students just brought up a good point, some techniques are not so good to do for the upper part of thoracic spine. Like the last technique that I showed to you, the pelvic pull, is very hard. You're pulling one ASIS and trying to press on T1 is kind of hard. In cases like that, you can always do, for example, do this technique until where it's comfy. For example, T7. You do T7, then you can do other techniques for the upper part. So you can mix and match like that. There is no law that says you must do, for example, pelvic pull from T12 to T1. If you see one technique is not comfy in the upper area, then just apply another technique that you feel more comfortable in that area. That goes for all the technique we show you for thoracic. Some of them just don't feel quite right for the upper part. So you can mix and match it and make it comfortable for you. The next technique that I'm going to show you is the cross hand technique. You learn that in the lumbar, so you're familiar with it. It's a prone technique, face down. It is a unilateral technique, so means you have to do it on both sides. The contact is with the pisiform of both hands, and the contact is posterior to anterior while doing downward rotation. So it is not P2A and then rotation. It is not rotation and P2A. It's a movement together of the P2A and rotation. So P2A rotation, P2A rotation, P2A rotation. So it's one movement. When you as a practitioner standing on the left side of the patient, the rotation is clockwise. So if I am now staying on this side of the patient, which is the left side, I rotate clockwise. When I am on his right side, I rotate counterclockwise, this way, away toward his left side. When I am on his left side, I rotate toward his right side. Okay, so on the patient's left, rotation is clockwise. On patient's right, rotation is counterclockwise. The treatment is done on the same vertebrae, and your pisiform is applied on the same vertebrae. And for that, you have to know your anatomy, and you have to be careful where you put your hands. A lot of times people put hands on two different places. So the ipsilateral TVP, the TVP that is closer to you, your pisiform stays with your finger facing the head like this. Elbow straight, shoulder on top of the hand, and your palm down. Now the other pisiform go to the other side, and the fingers facing this way, away from you, lateral to at the 90 degree to this hand. So my hand here now, fingers facing up, the other ones face at a 90 degree. But because my wrist blocking the joint, if I keep my hands like this, my pisiform will be on another vertebra. So I have to make my hand like this to remain on the same vertebrae, okay, and pisiform. So it is like this. So if your hand's like this, you won't. It's impossible, because this wrist and the other wrist will block you to be on the same vertebrae. So contact is like that. Then I press down. While I'm pressing down, a little downward rotation, not so much, just a little downward, and hold from 1 to 5 seconds, and relax, and then go next level. Take a skin and slack out, push 10% down, and then press again. Then next level, take a skin slack out, press 10%, and then push downward. Okay, so as before, my front knee bent, back knee is straight, my back is straight. I find the spinous process. I start with the one hand. I take the skin slack out toward the head to be on the TVP, and I push 10% down. Now my other hand take the skin slack that way, and that one push 10% down. Now I rotate, I press downward P2A while I rotating. See, this is the rotation. Push down and hold. Some students do like this. If you see so much rotation, that's not the way. Your pisiform must be stuck to the same TVP and work on that. If your hands moving like this, means you will not be on the TVP anymore. So your hand shouldn't move. So, and then you go next level, take a skin slack, push 10%, take a skin slack this way, push 10%, then down and rotate. You see how much rotated down and rotate. And then next level, take the skin slack out and push 10% down, and then push and down, push and down, push and hold for like 1 to 5 seconds, and then next level. Take a skin slack out, push 10% down. This hand take a skin slack that way, push 10%, push and down. So you see my rotation is that way, clockwise. If I work on this side, then is counterclockwise. Thank you.